Good evening, everybody. My name's Heather. I am a specialist bariatric dietitian for Healthier Weight, and welcome to my first live Q&A session. We've had plenty of questions in already, so really thank you for that. That's helped me structure what I'm going to say today. But I would really like you to ask any questions in the chat box, and I'll do my best to answer them as we go along. Today, we are going to talk about the gastric band, the bypass and the sleeve. We're going to talk about preparing for surgery, a little bit about surgery, and then afterwards as well, and the long-term sort of aspects. Prior to your choice on surgery, you really do have to make sure you research everything. You look into them all and you write the pros and cons for all of the surgery. The gastric band is more suitable for those who have a BMI of 30 and above, along with the ESG, the endoscopic sleeve gastrectomy, and the gastric bypass and the sleeve are specific for those who more suitable for those who are over a BMI of 35 and above. So whilst you're preparing for surgery, we do need to go through your health thoroughly. We have got to get supporting information if you do have any current mental health conditions, any current sort of other health conditions, maybe to do with diabetes, to do with your kidneys, or anything else that perhaps is going on that can pose a risk for your surgery. Once we've got all those supporting information, we are happy with that as a team, that you're ready to go ahead with surgery. We can then start to look at scheduling dates for you. You will have a pre-op call with one of our nurses at Healthier Weight, and you will also then have an appointment with a nurse at the hospital where you're having your procedure. You are required at this moment in time to self-isolate for 1 to 2 weeks prior to surgery, and again for afterwards, and also to have that COVID test prior to your surgery, because we want everybody to follow this green pathway going into hospital. Also, preparing for surgery is a lot about your diet as well, and often most clients going ahead for surgery need to do a liver reduction diet, and this is where you restrict your calories to maybe about 800 to 1,000 a day, and your carbohydrate intake is very, very little, so about no more than 100 grams of carbs per day. We call it the liver reduction diet, we call it the pre-op diet. You'll hear loads of different words for it. And the aim of it is to basically make your liver smaller. When the surgeon does the operation, so if you imagine this is your stomach, your liver, regardless of your weight, it is very, very big. And to make it smaller, we've got to restrict the amount of fat and the amount of carbohydrates that we consume to make it smaller, to make it a bit floppier, so the surgeon can lift it up out of the way, and then you can get to your stomach. So somebody's just asked when the bypass operations are to start again at the Heartlands Hospital. I'm assuming you mean with the NHS, because I understand that they aren't operating at the moment, but privately, yes, all private providers are providing weight loss surgery. So on the day of the operation, you will meet your surgeon and anaesthetist face to face. So the NHS, they're not starting back up yet, as far as I know, as far as I'm aware at the moment, unfortunately. So on the day of the operation, you will meet your surgeon and anaesthetist. They'll go over all the risks again for you for your chosen procedure, and a chance for you to ask any other questions that you might want to ask. When it's your turn for theatre, you will be under general anaesthetic, and if you have the gastric band, you'll be under anaesthetic for around about an hour, and it will be a bit longer, maybe an hour and a half, maybe even 2 hours for the bypass and the sleeve, just depending on your current situation, I guess, really. But your surgeon will be able to advise you a bit better on that when they see you and consult you. Most procedures are started off with being keyhole surgery if they're able to. Very, very rare do we see open surgery now with weight loss procedures. And generally you have 5 incisions across the top part of the abdomen. So sort of below your rib and above your belly button and in that area there. Once they are inside, they will put some gas into your abdominal cavity, lift up that abdominal wall to make it easier for the surgeon to move about. And then they'll lift the liver away. If we start off talking about the gastric band, this is the most simple of all the procedures that is on offer. And we simply wrap an adjustable band around the top part of your stomach. I'm just going to get that in position so I can show you. It locks a little bit like a cable tie, and it's around the top part of the stomach, and it surrounds all these little nerve endings from the vagus nerve. We then pull a little bit of the stomach up and over, stitch it here to help hold and secure it into place. Coming away from the band will be a long tube, and we then can attach the port to the end of the tube. And this port is then stitched on the muscle underneath your skin on your abdomen. And this is where we can then adjust the band. So you'll hear of band fills. The preferred term is adjustments because we can tighten the band, we can loosen it. So we're adjusting that volume in the band. And what we're looking to do is to get the right volume in this band, to put the right amount of pressure on these nerve endings to help reduce your appetite and to help you feel satisfied on smaller portions of food. It does take a good number of adjustments to build up that fluid in the band. The first one doesn't get done until at least 6 weeks after surgery, and we then leave at least 6 weeks in between appointments to allow you to adjust to the way of eating and what you need to do to make it a success as well. And I'll come on to the way of eating in a little while. So that's the band. The sleeve is becoming a really, really popular operation, a little bit more complicated, as you'd imagine, from a gastric band, but all the preparations are exactly the same. And what we're doing is simply reducing the size of your stomach. So the anaesthetist will put a special measuring device down your throat, and that will go all the way along your esophagus and towards the bottom of your stomach. And this allows the surgeon to measure what he's going to leave as he cuts and staples up through here. And he simply loosens and removes this outer part of the stomach. So you're left with a thin tube, okay, or the sleeve. This outer part of the stomach then gets pulled out of your abdomen, gets sent away to histology to make sure it's nice and healthy, but otherwise you don't see it again. The way that this works is, as you would expect, reducing the stomach volume, so you don't feel that you need as much to eat to get that sort of physical satiety, that fullness. But also it's quite a high pressure system, so it pushes the food through a bit quicker into the small intestine. And that means that your gut hormones can change. So we've lost quite a lot of the production of the hunger hormone from that stomach being removed. But because the food is hitting here a lot quicker, that satiety hormone increases to help you feel satisfied for that little bit longer on what you've had to eat. The gastric bypass, there's a few different types. I'm going to just talk about the Roux-en-Y at the moment. That seems to be the most common one that we can find, the standard one, if you want to call it that. A little bit more complicated in terms of surgery, as we've got to sort of work our way down the small intestine a little bit more. But that similar measuring device goes down your esophagus and into that top part of your stomach. And we are cutting and stapling across here to create a small little pouch away from the main part of the stomach. We then travel down the small bowel, about 1 metre, maybe 1.5 metres, separate that in 2 and bring that second part up and attach it onto this little pouch. This bit of bowel that's left dangling is then attached down this second part of the small intestine. Okay, so what this means is that when you eat or drink, your food will come down into this little pouch and then start trickling through into that second part of the small intestine and completely bypass the main part of the stomach and that initial part here. Okay, so after surgery, you will stay in overnight, normally for the gastric band, and normally 2 nights for when you've got a bypass or a sleeve. Okay, it can discharge you a little bit earlier depending on how you're recovering, but you won't know until you're in that situation. Somebody had asked earlier with a list of questions that came through about the recovery, and I think that's really important to consider when you're going ahead with surgery, is that it's the right time for you and your family or your support network, in that you've got people there that can help look after you. You need somebody to be at home with you for at least the first 24 hours once you are home, but you've got to make sure that somebody's there to help lift heavy things, maybe look after the children. It's your recovery, you kind of would class it maybe 1 to 2 weeks perhaps after your surgery. After that, you're normally kind of back up on your feet and you're able to move around a little bit more. So there's a question on vitamins. I'm going to come back to that in a little while. And somebody's asked, if I book a sleeve at the mid-September when I'm looking, if I book a sleeve in Stafford. Okay, so we should have, we kind of, when you're booking surgery, you will speak to the patient care coordinators. You'll speak to the patient care coordinators, and they will initially sort of take a baseline assessment of you about your current health conditions, and then we'll then go on and book your consult with the surgeon. We do need to leave at least 2 weeks between that booking date and that surgery date for legal terms, but also to make sure that you have prepared enough as well, because quite often you might need to be on a pre-op diet for 2 weeks if your BMI is over 40. Or we might need some further information from other medical conditions, and that might take a little bit longer. Before you can drive after surgery, so that's a really good question. Generally, it's around about a week. I would check with your insurance to make sure when they're happy for you to drive after general anaesthetic. From our point of view, we want to make sure that your incisions are starting to really heal and that you're not putting any extra pressure on them, particularly if you're driving. You have to sort of stop suddenly, do an emergency stop. We don't want to put any extra pressure on them that's going to burst them open and then increase the risk of an infection. So moving on to the post-op diet. It's a question that I think, and a topic that a lot of people are really, really unsure about, because the advice varies from provider to provider, from surgeon to surgeon. Generally, unless you've been advised differently, you will need to do a liquid-only diet for 2 weeks. And this is where you are on meal replacement shakes, on protein shakes or soups. Somebody or some people aren't keen on soups, or they aren't keen on shakes. And that's the beauty of this stage, is that you can sort of flip it over to one of the other options if you don't. Once we've done that 2 weeks of liquids, we then move on to 2 weeks of pureed foods and soft foods. So really, really sloppy. And you've got to think it as if you're weaning yourself back onto a normal diet. As if you're like a baby, I guess, really. But your portions are going to be pretty much baby portions. They're going to be so small, and we want you to eat very, very slowly. And this brings me on to that eating technique. And you may have heard it, you may have not. It's called the 20-20-20 technique. So a 20 pence size bite, chew everything really, really well. And once you've swallowed, you wait at least 20 seconds before you take another bite of food, and then you repeat that process for about 20 minutes. So somebody's just asked, what other liquids would you suggest for the liquid stage, as they really dislike soup? So your options are going to be meal replacement shakes and protein shakes. Milk, you can use milk to make up low calorie drinks like coffee, or light Ovaltine, light malted drinks, light hot chocolate. We've just got to be careful with those types of drinks and make sure that they are the light options and you're not having too many of them, because of the sugar content will soon add up and would likely cause a little bit of nausea or maybe loose bowel movements for you. with protein shakes and with the meal replacement shakes now, compared to when I first started in this area 10 years ago, there's so much more availability, so much more choice. There are even vegan ones that aren't milk-based, so often maybe a little bit more palatable after surgery if you're feeling quite nauseous as well. So I hope that helps answer that question. Somebody's asked if having their gallbladder removed helps. It doesn't help in terms of the actual operation and doing the operation, and doesn't help the surgeon in that way. It only benefits you in the long term, because when you have your gallbladder, whether you gain weight quickly or you're carrying excess weight, or whether you lose weight quickly, increases the risk of gallstones and the need of having the gallbladder removed. So if you're thinking about going ahead with weight loss surgery and you've already had your gallbladder out, then that's probably a bonus, to be fair, and you're less likely to have that trauma later on if that was to happen. So going back to the shakes, somebody's asked, do you recommend getting the ready-made shakes or powder to make yourselves? Either or, doesn't matter, whatever's easier for you. Your focus is going to be very much on protein, and we do advise you to aim for about 1 gram of protein per kilogram of your ideal body weight. So that's when the weight at which your BMI would be 25. That's how many grams you would need. So generally it's around about 70 for the average sort of clients that we see, but it can be as little as 60, or some people need maybe a bit higher to 90. So if you're choosing a shake, you want to make sure that it's fairly decent in protein, so maybe 15, 20, 25 grams of protein even, because you don't want to be choosing one that's maybe got 10 or less, and you're going to have to have a fair few during the day to get that volume. Once we've done that initial post-op stage, we'll be moving on to solid foods and trying to get back to what we would call a textured diet. And this helps all of these procedures that we've spoke about for them to work. The gastric band, so as that's around the top part of your stomach and surrounding these little vagus nerve endings, we're wanting to stimulate that more with having solid foods. So as your tiny little bite of food is getting squeezed through that band, it will stimulate those nerve endings more to allow you to feel satisfied on less food. If you can imagine something really soft and really sloppy, that's just going to slip through dead easy. It's not going to touch the sides, essentially. It's not going to stimulate those nerve endings. So you'll be able to eat a decent amount and feel hungrier quicker. So with all surgeries, the texture of your food is really important. The sleeve, again, if you've got something really more liquidy, that's going to slip through quite quickly, not really satisfy you. And the same with the bypass, that's just going to flow on through, flow on past these gut hormones here that we want to increase with feeling satisfied. So once we have done that initial post-op diet, we are happy that you've healed internally, and we're ready then to progress onto that next stage. And again, your focus is still going to be on protein, really, to make sure we're getting enough. So this brings me on to supplements. So somebody asked about, in the vitamin list, it mentions the Baracol, or the chewable Baracol vitamins. Are these suitable, as I thought we couldn't have solid until 5 weeks? Okay, good question. So Baracol, for those who don't know, is a Swedish brand who formulated a complete bariatric multivitamin and mineral supplement. It covers everything that BOMS advise, and BOMS are the British Obesity and Metabolic Surgery Society, and they did a lot of research over the years and came up with sort of a formulation that people who have had a bypass in the sleeve need to take to make sure we reduce the risk of developing a deficiency. So Baracol did that. Their supplements include a really, really high dose of vitamin B12. So they do say that you perhaps then don't need to have the vitamin B12 injections every 12 weeks, but to get your levels checked on a regular basis. So after surgery, so generally we don't advise you to take supplements straight away. You've got a lot going on. You can feel quite nauseous. You can feel, like there's too much sort of things to try and focus on and try and fit in during the day, trying to fit in your food, trying to fit in enough fluid throughout the day, and then add on that some supplements as well is quite tough going, a bit of a challenge. That said though, if the supplement is in a chewable form or a powder form that Baracol also do, you can take that straight away after the surgery, because you're breaking it down right in your mouth to the point that it dissolves, and then you swallow the liquid essentially. I've tried the chewable ones and they just break down. So you should be okay to have that earlier than the 5 weeks if you wanted to. Solid tablets should be avoided for at least 6 weeks after a bypass or a sleeve. With the band, if they're fairly small, you're generally okay to take them, but if it's the big bullet type tablets, you want to avoid for a little while, or look at trying to get your GP to change to a different one for you. So somebody's asked if the Tesco multivitamins and minerals are okay. Absolutely, as long as you're taking it twice a day. So with that one, they only give you per tablet 1 milligram of copper, and BOMs advise to take 2 milligrams of copper. So as long as you're taking it twice a day, ideally separate as well if you can get into that routine, then you're more likely to absorb as much as possible from each of those. On top of that, you do need to obviously take the calcium, vitamin D and iron, and then your B12 injections as well. So somebody's asked if I would recommend Baracol or Forceval. I think it's more personal choice, to be honest, and they're very, very close in terms of the micronutrients and what they provide. With Forceval, you only need to take 1 a day, whether that's the soluble form, whether it's the capsule form. But with the soluble form, is not that well tolerated. It just doesn't taste very nice. And the capsule form is quite big. So if you struggle with that, then the next best thing probably would be Baracol, to be fair. So moving on then to another question, with going back to the band then, I suppose, and the eating technique. So somebody's written, a friend of mine who had the band said she often feels sick and feels food backed up and can literally feel it drop through the band. Okay, right, let me get my little model again and show you what's happening and why it's happening. So when food is backing up, what they mean is it's sitting above the band and it's building back up the esophagus, and you can feel that coming right up to your chest, okay, and almost to the back of your throat. Now this could be down to 2 things. It could be down to them not eating correctly, so taking too big a bites, or eating too quickly, not giving it a chance for that single bite of food to get squeezed through the band before they send another one down. So it's starting to build back up. The most likely scenario is that the band is probably a little bit on the tight side. So if this band is too tight, then no matter really how you chew your food, you're going to struggle. And the food is going to start collecting above the band. It's going to start building up. But we can also run the risk of developing something called pouch dilatation. And over time, if that's not looked at, that constant discomfort with eating, that build-up of food, can cause this area to stretch. And we don't want that, because that often means that we need to completely empty the band to hopefully allow that to settle. Or it might be that we need to remove the band if it is too bad. So with your friend, you can say, well, let's talk about your eating technique, or if you've seen her eat it, and just say, think maybe if you heard of this technique, the 2020, they might not have heard it. And it might be that she does just need to have a little bit of fluid removed from the band just to loosen that off and allow things to pass through comfortably. Somebody's asked, how do you get enough water in after the sleeve? I'm worried about feeling faint, etc. So it is hard. In that initial stage, you're on liquids only. So generally in that time, you can manage your fluid intake quite well, because your soups, your protein shakes, your meal replacement shakes will all account for your total fluid intake. And we want to aim for at least 1.5 litres, ideally 2 litres of fluid a day. It's when you start to introduce food that it does get a little bit more of a challenge, because you will be advised to not drink with a meal and to not drink for at least half an hour after a meal. So you'll almost have to plan out your day around food and fluid. Sip slowly. Don't overface yourself with a too large a drink. Okay. Have small cups. Know how much volume you're getting in those cups, so you then got a rough idea of how many you need during the day. Okay, to build that up. Most of the time, people do manage okay and do manage at least 1 litre. Okay, and it's good. Don't want you to be anxious about it. The more anxious you are, the more tense you get, and the more difficult it can be. So you've got to be nice and relaxed. Okay, and you can manage it. You can manage about 200 mils. Should take you maybe about half an hour or so, but you should be okay to do that fairly frequently to make sure you're getting enough throughout the day. So post-surgery, if you work out, are you at risk of being undernourished if you can't eat enough? Potentially, yeah. Even if you don't work out, if you don't eat enough, or you don't eat a nice balanced diet, you don't take the right supplementation, there is always a risk that you can be undernourished. Quite rare though, I have to say, from what we see. We do review a lot of blood tests from people who have had surgery, and most of the time they're all fairly normal. There's a few common sort of deficiencies that pop up, and that can be iron, folate, vitamin D as well is quite a common one. If you aren't getting enough protein and you're really working quite hard at the gym, your body is then going to start breaking down things as well. So if you're not nourishing yourself with diet, and you're still trying to function and push yourself doing more, it's going to find things from elsewhere, and it starts to look at your muscle, and you can see muscle wastage. And once that's done and gone, you know, it can start on your organs and things, which is in the most severe cases. So we don't hardly see that at all. So exercising after surgery, once you're recovered basically, and once you're back onto sort of a solid food diet, so generally we advise to leave exercise until you're maybe about 6 weeks post-surgery. Prior to that though, we do encourage you to be on your feet from day one. After you've had the operation, we want you to be pottering about. We want you to be walking to help reduce the risk of a DVT. So that would be a blood clot forming in your calf. So yeah, you can go out for walks, absolutely. Anything more strenuous that's making you work that little bit harder, leave that until you're 6 weeks post-op. So going back to the Tesco vitamins, that's fine, Beth. So assuming they don't have everything I need post-surgery, so no. If you're taking them twice a day, you still need additional iron, and you still need extra calcium and vitamin D. If you are having regular menstrual cycles, regular periods, you need another 100 milligrams of iron a day. On top of that, you need to get at least 1,200 to 1,500 milligrams of calcium through diet and supplements. Obviously, you can get calcium through a lot of dairy products. And vitamin D, you need another at least 20 micrograms on top of what you're on the Tesco vitamins. So you essentially need 3 different things, really. So drinking, let's talk about drinking a little bit. So why can't we drink 30 minutes prior to eat and 30 minutes after? So the prior to eat and drinking tends to be a little bit more of a personal choice and what you feel is comfortable. And it's more so for those who have had a bypass and sleeve. When you're eating, your food is obviously coming down into your stomach, staying there for a little while. The same with the bypass, essentially coming down and flowing through into the intestine. If you're drinking with a meal, you run the risk of diluting the food more, so it sort of thins it out, it's not so thick, and it flows through quicker. it means then that it's flowed past these intestines here a lot faster. So you then perhaps don't feel as satisfied on what you've had to eat. You maybe think within half an hour, you think, gosh, I feel hungry again. That food seems to have gone. And then you run the risk of starting to eat more and potentially putting weight back on. Okay. So we want you to really avoid drinking with a meal. We want you to avoid drinking soon after that meal and wait at least half an hour to give it a chance to get squeezed through, to give it a chance for this gut hormone to do its job in increasing to helping you feel satisfied in what you've had. Okay. So somebody's asked, will we always have to sip water, or eventually will we be able to drink normally? You'll find as time goes on that it will be a little bit easier to drink. So after surgery, you're taking small sips, you're waiting, you're taking another sip, and you're waiting. As the months go on, as the years progress, you will be able to sit there and drink a drink. You might find it a bit uncomfortable if you were to say down a drink, okay, but you should find that you're able to drink that a little bit more normally, is what you would class normally as the months go on. So another question, is it okay to walk my dog for 30 minutes a day from post-op, or should I leave it for a while? Depends what size your dog is. So if it was my dog and he's a collie and he pulls, I would say no. If you've got a little dog who's brilliant on a lead or off lead, then a little stroll I should think should be absolutely fine. You'll know yourself though, Beth, whether you feel well enough to do it. You might want to break it up a little bit, so maybe do 15 minutes and then do 15 minutes later on, okay, when you feel that you're able to do that. Okay, so just see how you go. If you've got somebody that perhaps can do it for maybe the first couple of days, then that'd probably be a good idea, and then you can get a better idea of how you feel after. Somebody said, is it okay to have a depot injections after having a sleeve done? Absolutely. So contraception is an important one to talk about, actually, so I'm glad you brought that up. Oral contraceptive sort of pills aren't the best or the preferred method of contraception after surgery, and that's because we're not too sure on how the absorption of the drug is affected with whether you have a sleeve or the bypass. We do want to avoid pregnancy for at least the first 18 to 24 months after surgery, and that's because at that time your weight loss is the fastest. We want to wait until your weight's stable. You'll be more of a healthier weight for you, but as well you run the risk of having a low birth weight baby if you fall pregnant soon after the surgery, so you have to be really, really careful. So having the depot injection is much better actually than having to take the oral contraceptive each day. So I just wanted to talk a little bit more now about hunger and head hunger. Emotional hunger kind of comes up quite a lot. Sorry, before I do that, I just missed the question of, will I be able to go up a flight of stairs after my operation? I live in a first floor flat. Yes, I should think you'd be okay. Take your time, but you should be absolutely fine. It's something that you're used to. It's something that you do every day. And it's not going to be a huge amount of stairs, so you should be okay to do that. So yeah, hunger, head hunger, emotional hunger, something that clients get referred to me a lot about because they're struggling with. And as I was preparing for this session tonight, I asked my daughter, she's nearly 8, I asked her why she eats. And she said it was really simple. And she just said, to be healthy and stay alive. And it made me wonder, at what point in our lives did we then think that we needed food for other reasons, whether that was comfort, whether it was because we were stressed. What made us think it was okay and what made us do that? So that head hunger and that emotional hunger, we've always got to think about why we're doing it. What is the reason that we're going for those foods? And it's that cause, that trigger, that needs to be worked on rather than the type of food it is. Because often when we go for foods in that state, it's foods that perhaps are higher in fat, higher in sugar. And your body is, when it's in that sort of state and in that stress state, it wants those foods. It wants those quick energy foods because it's thinking, right, what we're going to need something quick here to get out of this stress state, that fight or flight type thing. And that's why we go for those types of foods. So we've really got to work on those triggers first before we can look at the diet as such and things. But a really, really tricky one. And I would say that if you are eating through emotional hunger and that seems to be your main issue and the main reason that you're looking at weight loss surgery, is try and work on that first. Try and have some therapy, talking sessions, self-help, anything to try and just help manage that little bit better. So another couple of questions then before we finish. So am I okay to take my usual medications every day? Also, I am on diuretics, so worried about drinking enough. Most of the time, yes, you can take your usual medications every day. Depends on what they are. There are some medications that we do advise to avoid lifelong after all the weight loss procedures, and that would be non-steroidal anti-inflammatory medications. So things like ibuprofen, diclofenac, naproxen. Okay, they are prone to causing gastric ulcers, and we do not want you to have a gastric ulcer after your surgery. So whatever the form, liquid or tablet, capsule, we advise you to avoid those completely. For the first 6 weeks after bypass or sleeve, we do want you to avoid tablets. So if those medications have to be taken every day, then we will advise you to get them in an alternative form. So most of the time it's liquid, or if you're able to crush them. But you would need to speak to the prescriber, so either your GP or the pharmacist, to get a little bit of advice on those. The diuretics, yeah, I can obviously see that being a concern for you and worried about drinking enough. We will just see how you get on. We've got a great team of nurses with us, but you will be managed wherever you go and wherever you choose for a procedure, and they will advise you on your specific list of medications and what you're taking. Okay. Can you still take Anadin extra for headaches? Yes, absolutely. You can take that. It's only a low dose of it is a low dose of non-steroidal anti-inflammatory. So you just got to be careful that you're not overdoing it really and taking it regular. If you can get another form of pain relief that would manage your headaches, and that would probably be better than taking aspirin on a regular basis. So I've been told that hair loss is common after having this sleeve. Is this true? So hair loss is common, can be common after any weight loss procedure, not just the sleeve. The reason it happens can be a few things. So not meeting your nutritional requirements, not taking your supplements, so having deficiencies, but also the rate of your weight loss. So even if you're getting the right amount of protein, you're taking all your supplements, you're losing weight really, really quickly, your body is going to be thinking what's going on. And sometimes you can lose hair. Sometimes it can just be thinning out the hair a little bit. Other times people can report clumps coming out. And obviously that's very, very distressing for a lot of people. The best thing you can do prior to surgery is to make sure you're in the best nutritional state beforehand, so you can get on your vitamin and mineral supplements prior. You can make sure you're having a fairly decent diet, and obviously you'll be doing your pre-op diet anyway. If it's going to happen, it's going to happen, I think, and some people are just more prone to it than others, and we don't know why that is. But after a while, after your the weight loss has slowed down, the hair loss will slow down, and as long as, again, you're in that good nutritional state, you will start to grow that hair back again. You'll notice obviously the tiny little regrowth, and then it will start coming back through. Another question then, can your stomach stretch back to the way it was before? So with the band, we're obviously not altering the size of the stomach anyway, so we don't need to worry about that one. The bypass and the sleeve, yes, we can stretch the stomach. Whether it will go back to the same size it was before, I don't know. But you have got to be pushing it really to be able to do that. The sleeve, with it being quite a high pressure system, it's very, very difficult, and it can be very uncomfortable for you to overeat. And that's why your stomach will stretch, is if you've pushed it. So if you've eaten too much on a regular occurrence, we can start to build up this food here even more, and just put that bit of extra pressure on this staple line, and eventually it can stretch again. It's quite rare though, it's quite hard going, to be fair, but generally it's down to how you're eating your food and what you're doing, whether that would happen or not. Okay, so I hope I've answered everybody's questions and not missed any. I'll have a quick flick through. Has anybody got any other questions before we finish? Oh, there's one other question. I've just turned over my page from somebody sent in before about excess skin. So as well as hair loss, excess skin can be quite distressing for people. And again, this is the one that if you're older, if your skin has been stretched from carrying excess weight for a longer period of time, you are more likely to have loose skin. And no matter how much exercise you can do, that skin is still stretched, and that's not going to go back. It's lost that elasticity in it. So we can exercise to help the muscle tone underneath, and it can help pull things back in. But if that elasticity is gone in that skin, then we're going to have some loose skin. And that can be problematic for some, depending on how much you have as well. And quite a lot of people then go for further skin removal surgery, so abdominoplasties, apronectomy, even arm lifts, leg lifts. A lot of people do that just to make the most of the surgery and the weight loss that they've achieved as well. So on that note, I think we will finish just now. Thank you all for attending. Thank you all for your questions. I hope you've enjoyed it and found it really useful. More information can be found on the Healthier Weight website as well, if you want to read a little bit more in it. But thank you again. Enjoy your evening. Bye-bye.